Hello, my name is Karen Wagner. My company, Behavior Services of Brevard, provides applied behavior analysis and intensive behavioral adult day training services in Cocoa, Florida, as well as in-home behavior analysis services throughout Brevard County. We also provide behavior analysis CEUs on our website, thebehavioranalyst.com. Recent emergency cuts to the Agency for Persons with Disabilities, or APD, provider rates have been in the news of late, but there appear to be several misconceptions about how individuals are funded under the Agency for Persons with Disabilities. Consumers receiving services under the Medicaid Waiver, the primary funding source under the Agency for Persons with Disabilities, are funded individually. No service provider receives money directly from the APD to fund programming. Providers accept consumers into programs and piece together funding from each individual served in order to pay staff and overhead. Consumers are funded by hours or staffing ratios. For example, John requires one-to-one staffing due to his severe behavior challenges. Providers cannot change the staffing ratio of a consumer who is funded at a particular rate. Providers are not employees of the state. Providers are contractors. Despite statements from various APD staff, providers are not ultimately responsible for the consumers. The state is. Every vulnerable consumer left without medically necessary services is a potential case of abuse and/or neglect against the state. Each consumer has a waiver support coordinator, like an independent social worker, that the consumer and his advocates choose to help him or her obtain necessary services. These support coordinators do not work for the state. They're independent contractors who agree to assist in negotiating the complex funding system for services. Support coordinators are responsible for all the consumer's paperwork relating to funding, and they're on call 24 hours a day if a consumer has an emergency. The support coordinator must respond to the emergency and try to find the necessary supports so that they remain safe. Support coordinators receive several weeks of training and are then paid as contractors by the MedWaiver program, but they are employed by the consumer, who has the right to hire and fire them if they feel the coordinator is not a good fit for them. The consumer, their advocates if they have them, and the support coordinator determine the needs of the individual and create a support plan which outlines the services necessary to stay safe and healthy for the coming year. Services funded by the waiver are limited to those that are deemed medically necessary by the state of Florida and the Agency for Persons with Disabilities. Some services, such as in-home supports, respite, and companion, are intended to assist the families and caregivers to provide care for the consumers. Many consumers live with family members who are disabled, elderly, or have several other children. The special needs consumer may need so much additional assistance with bathing, dressing, and other personal care that the family simply cannot provide it. Some consumers with behavior challenges are difficult to manage in the community. Adult consumers can be a particular challenge when they become bigger and stronger than their caregiver. In order for this individual to go to the doctor, get their hair cut, attend church or family event, the caregiver may need the assistance of a trained staff person. Conversely, the individual may not want to attend a family event, or it may not be appropriate for the consumer to attend a caregiver's appointment. Respite care provides a trained staff person to stay with the consumer while the caregiver is gone. When the support plan is finished, the support coordinator assists the consumer in finding providers for the services, then sends the request for services to the APD, and the services are either approved or not approved. If the services are approved, the previously identified service providers are issued authorizations that indicate the service being requested, the number of hours approved for the cost plan year, and the rate at which the services will be reimbursed. Providers cannot bill for services without an authorization approved by APD. This year, as in many years past, APD distributed service authorizations for a full year of service, knowing they could not fully fund them. Once the consumer is approved for these services, they are, in effect, entitled to the service as long as they need them. If the state attempts to reduce services to an individual, the individual has a right to due process. This means the consumer and their advocates have a right to meet in front of a hearing officer or judge to argue why they need the service that was previously approved as being medically necessary. Due process does not guarantee the consumer will keep the service, but the APD is required to continue providing the service until the case is resolved. Since due process also has an appeals process, the length of time can be excessive between the time the services were supposed to be reduced until the time the case is resolved. This is a very important point, because when the state legislators refuse to fully fund the MedWaiver program, the APD can't just cut services to the individuals. Consumers can't have a bed in a group home for 9 months of the year and be homeless the other 3. APD has to use legal processes, and this may take several years to resolve. Wise legislators of years past have added language in the law to protect individuals with cognitive disabilities and included services such as applied behavior analysis. Consumers are protected from receiving chemical restraints such as injections or sedatives in order to render them insensible if they're having a behavioral event. If several such incidents occur, the law states the individual must receive a behavioral assessment done by a board-certified behavior analyst to help determine why the behavior occurs. Medical personnel are typically involved in the process to make sure there are no medical or dental conditions that are contributing to the behavioral events. If ongoing behavior services are needed, the board-certified behavior analyst is responsible for authoring the behavioral intervention, and if the behaviors meet certain criterion, the BCBA must present the program to a local review committee. The BCBA must also train the parents, staff, or other caregivers who are implementing the program. The legislatively mandated behavioral services came about after horrible events in the past when consumers' rights were violated by institutions, state agencies, and false experts who segregated, neglected, and incarcerated individuals with cognitive impairments because of their appearance or their behaviors. The additional rights provided to our consumers under state law are in the spirit of the Americans with Disabilities Act. Subject to the provisions of this subchapter, no qualified individual with a disability shall, by reason of such disability, be excluded from participation in or be denied the benefits of services, programs, or activities of a public entity or be subjected to discrimination by any such entity. If we were to look closely at the actions of the APD and the legislature in recent years, we would see that consumers may have been victims of discrimination. Due process is required, but because they lack the wherewithal to defend themselves against reductions in their services or funding, there are many who may have had services reduced in error. The provision of a support coordinator is inadequate for the consumers to participate fully in due process, as the consumers are insufficiently capable of defending their services due to their disability. And their support coordinator is not trained to act as a de facto legal representative in these hearings. APD always has several representatives at the hearings, including at least one attorney. However, consumers and caregivers are told they can bring an attorney if they want to. Most consumers do not have the resources for an attorney. Although consumers are allowed witnesses, these testimonies are frequently discounted as they are given by service providers with a vested interest. Yet, many times the consumer doesn't have anyone but providers to explain the need for services. In the meantime, is the implication that the 8 people at the table for APD do not have a vested interest in the proceedings? Those consumers with the best opportunity to retain services are always those with their own attorneys, meaning individuals without attorneys, family members, or other advocates are almost guaranteed to lose services every time a reduction is proposed. Waiver support coordinators are required to inform consumers about due process, but the consumer has to initiate the process. Some requests for due process have been rejected outright because a family member filled out the paperwork. If a consumer is unable to read or write due to their disability, how are they supposed to initiate due process, let alone participate? APD Acting Chief of Staff Brian Vaughn, in a statement about rate cuts of up to 40% for providers, said, "These actions are necessary to comply with the statutory obligations so that we are not forced to eliminate services to this vulnerable population. APD is committed to protecting the health and safety of Floridians with developmental disabilities while living within our budget. So the elimination of providers, resulting in the elimination of consumer services, is to preserve services? Preserve them for whom exactly? The APD cannot function within its budget if the legislature will not fund it. Reducing provider rates will put providers out of business. But this is also an obvious method to cut services while denying the consumers their right to due process. The state cannot say they are preserving services when the rates being offered cannot sustain the service. Rate cuts prior to 2011 have already forced providers to eliminate benefits in order to pay minimum wage. Our staff here at the ADT agreed to a temporary pay cut of up to 25% during this crisis in order to keep services on consumers' authorizations. Otherwise, consumers would have the ADT and other services removed from their cost plans. And when the authorizations rolled over in July, the consumers would not have the services in their 2011 and 2012 cost plan. Since 2006, APD has been reducing services by doing authorization splits, voiding existing service authorizations, and then reissuing new ones that are divided arbitrarily without obtaining utilization information from providers. They have used this several times in a single year. Providers must spend hundreds of hours trying to get hours restored, but for many consumers, the hours are lost. Tracking utilization is a nightmare for providers. Rebasing removes services that were not used in the consumer's previous cost plan year because they must not have been needed. Rebasing was another opportunity to do an authorization split while removing services at will. Consumers not only lose the rebased services, they tend to lose the hours from other services as well. These cuts were first done in 2008 without an opportunity for the consumers to protest the loss, and were done even when providers and support coordinators had documentation indicating the reason the services were not used in the previous year was because of the APD. There were cases where authorizations for necessary services were refused because APD stopped processing any authorizations for several months. By the time the authorization was received, the consumer did not have enough time to use the services before the end of the cost plan year. APD still removed the unused hours. Consumers even lost services because they were hospitalized for several weeks in the previous year. The legislators directed APD to add 5,000 persons to the waiver in 2005, but never provided additional funding. Statements by state staff that consumers need to give up some services so others can come on the waiver only displays their ignorance of the process. Should consumers become homeless so another consumer can receive ADT? Since 2005, new enrollees are only added as crisis cases. These individuals, by definition, are entering at a higher cost because they either require residential placement, an adult day training program, extensive medical or behavioral supports, or combinations of all four. All authorizations are stored in the ABC system, an ancient system built in the 1980s that was never updated. It's written in DOS, which is like Pong, for those of you who remember. Consumers are subjected to the service losses because the APD doesn't ever know how many services have been used. Support coordinators do not have access to provider billing information, and all service usage has to be hand entered into the ABC system. This incredible inefficiency has been allowed to continue for years at the expense of the consumers and the providers. We have three problems that must be resolved. One, we need to ensure the state does not continue to deny consumers their right to due process when their services are cut by unknowing or ambivalent legislators and state agency personnel. The second, MedWaiver services must be funded. If funding must be reduced, all processes should involve all of the stakeholders, and APD must stop doing knee-jerk responses that violate consumer rights and cause immeasurable harm to everyone involved. Third, we need to have provider rates restored to at least 2003, the last time an actual rate study was done. And we need contracts that put some stipulations on the state to pay the providers for the services they contracted for, just as they do for contractors who don't work with individuals. with disabilities. I thank you for your kind attention.